Good evening, and welcome to Hello, It's Us, Perspectives on Inclusion. This program is dedicated to educating the general public about issues that are important to the disability community. But we operate under the premise that in educating and talking about issues that are important to the disability community, we're really touching on everyone's lives because people with disabilities are such an important fabric of the general public and the community at large. Hello, It's Us is brought to you through a collaboration between the University of Iowa Center for Disabilities and Development, Uptown Bill's Coffee Shop, and the good people here at Public Access TV. My name is Mike Hoenig. I am generally, most of the time, call myself a co-host here with Hello, It's Us. I work for the University of Iowa Center for Disabilities and Development as a program manager. Keith Ruff, the longtime co-host of Hello, It's Us, is unable to join us today, so I'm going to be flying solo, as they say. But I've got a great team with me here of colleagues and people that I've known for a while, so it's going to be a lot of fun. We're going to have a conversation. Our topic today is going to be Iowa's State Disability and Health Program. And I'm pleased to welcome to the studio Maggie Ferguson, who many of you hopefully met last week as she and Jeff Lauer talked about the Brain Injury Alliance of Iowa and the Department of Public Health's contributions to brain injury in Iowa. So Maggie, thanks so much for coming back and joining us.
Yeah, thanks for having me.
And we have Caitlin Owens, who last week served as a co-host actually for the last two shows, but she wears many hats. She serves as a program manager at the Center for Disabilities and Development and is a very active partner on the Disability and Health program. So welcome back, Caitlin.
Thank you.
So I'd like to just start by asking each of you to tell us just a little bit about your background and what brought you into the field of disability, and we'll start with you again, Maggie.
Well, I started in the field of disability when I was in college. I actually worked at the Easter Seals camp at Sunnyside, and I'm from Minnesota, so I would come down during the summers to work at camp and then just stayed in Iowa. And so from there, I've continued to work with people with disabilities, have greater inclusion in their communities and to support them. And spent some time working at the Brain Injury Alliance of Iowa, as well as now more currently working at the Department of Public Health.
Terrific. Well, and we're recording this show 2 days after quite an exciting football game. I don't know if you're a sports fan, Maggie.
I am, and I hate to say I left early because I was so disappointed they had lost. To find out the Vikings did not actually lose that game.
Oh, that was one of the most exciting games I've ever seen. It was just incredible.
I'm not a sports fan, and even I know that was an exciting game.
Well, Caitlin, tell us a little bit about your background and kind of what brought you into the disability world.
Absolutely. So my experience with people with disabilities also started in mainly in college, but a little bit in high school as well. I volunteered for organizations that weren't explicitly working with people with disabilities, but a lot of the people who I was coming into contact with had disabilities, and I was a social work student at the time, and it just became a population that I just really loved working with. And after college, I had several jobs in direct service, providing various types of support to people with disabilities, and then started working here at the Center for Disabilities and Development about 3 years ago. And yes, that is
great. It's just so fun. I mean, both of you from young ages really were exposed and have stayed in the field, and we're certainly grateful for that. So, well, as I mentioned at the outset, today's topic is Iowa State Disability and Health Program, grant, however you may want to talk about it. And as I said, I've got if Keith had to be gone for a particular time, this it's working out well for me because it turns out that all three of us happen to work within the Disability and Health program. And so what I'm going to do is ask Caitlin and Maggie to provide a bit of an overview of what we're talking about when we say the State Disability and Health Program, and then we'll kind of dive in and start talking about some of the programs that we do.
Couple years, we had a new grant that really focused in more on the disability and health of people with mobility limitations and intellectual disabilities. And so we've been focusing our efforts around improving the health of those particular populations.
Okay, great.
Yeah, and specifically this current grant, this current 5-year funding cycle that we're in, the goals that we're really trying to influence are improving the Iowa public health system capacity, developing Iowa Disability Service Organization capacity, and increasing Iowa health provider knowledge and accessibility. So, the kind of simpler way to say that is we're working with local health agencies to help them increase the inclusive practices and policies that they're implementing, working with disability service organizations on helping them also increase opportunities for the people they serve to be more physically active, to have better nutrition and that sort of thing. And then also, and I don't need to tell you about this, Mike, but the work that you're doing to educate healthcare providers across the state, and both practicing professionals and people who are learning to become doctors and nurses and that sort of thing. And I think also it's important to mention the kind of really the main focuses of this program are physical activity, nutrition, and reducing obesity among people with disabilities, which is important because people with disabilities experience disparities across all of those domains more than people without disabilities. I mean, there's the obesity rate is high in America anyway, but people with disabilities are often, they have more chronic health conditions related to lack of physical activity and poor nutrition, and oftentimes doctors, teachers, people just aren't talking to people with disabilities about this type of thing.
Yeah, and that's really exciting to me because I have had the opportunity to be involved with the Disability and Health Program for quite a while. And, when I was first involved with it, kind of the big project that I was involved with anyway was the Living Well with a Disability, which some of you may have heard of. It was a program that was offered, again, funded through the Department of Public Health and then administered through CDD along with providers, primarily independent living centers and agencies on aging throughout the state. And so that was a direct attempt to reach some individuals with disabilities to try to increase physical activity, which in turn hopefully would reduce secondary conditions, reduce hospital stays, reduce the chances of having those secondary disabilities. And it was a great program, but one of the problems with it is that it was really limited to, first of all, people who had a motivation to participate in it and were willing to stick with it. And it was also limited by geography to those areas in the state where it was offered. And what's kind of been, and it was a struggle, quite honestly, for me and for a lot of the Centers for Independent Living when it came time to say, we're kind of moving into a different direction. But as the two of you are starting to describe where the Disability Health Program is aiming at, really, it's much more trying to change the system, it seems like, to where it's has a potential to really impact a whole lot more people with disabilities all over Iowa.
Definitely.
That's right. We want to make sure that people with disabilities, we talk a lot in public health about making the healthy choice the easy choice. And so working with programs that offer fitness programs or nutrition programs to make sure that they're being as inclusive as possible. So having a very welcoming environment through maybe their marketing materials need to have images of people with disabilities on it, or maybe their location could focus a little more on how to be more accessible or easily navigatable for people who have some mobility limitations or use a wheelchair. Even the language that we use, making sure that it's person-centered. person first, so that we're focusing on the individual and not their disability. Those are all factors that can make an environment or program more welcoming to people with disabilities.
Absolutely.
Yeah, I think, I know that through the Disability and Health Program, over the years we've learned, and probably not just through this Disability and Health Program, but that, even people who do maybe have a motivation to really want to become more physically active run into a lot of those barriers where they just don't feel that they're welcomed, or they don't, they're not marketed to. So there are any number of things that I think are, that can be addressed to help people feel that they really do belong in those settings.
Absolutely. And I think that, kind of gets to the point, and just exactly what Maggie said, a building can be physically accessible to a person with disabilities, though we know that oftentimes, they're not. But, kind of beyond those basic requirements of accessibility, do people feel welcomed and included, and are they do they even know that these opportunities exist? And do fitness instructors or people teaching classes know how to make modifications in case they have a person in their class who has an intellectual disability or some other type of disability? Right. It's really about making them part of things that are already existing, and helping people do that in a meaningful way.
And that's a great point, because we don't need to offer anything that's different from what is already being offered. People with disabilities want to feel included. They don't want something separate. So helping them understand, you don't need to reinvent the wheel. Just make some minor modifications to the work that you're already doing.
So are there, I think that people are really resonating with that, because I think there's much more of a sense of wanting to be included than there was at one time. And obviously there are still some programs that aren't necessarily following that model, but in terms of the Disability and Health Grant, you mentioned a couple of different opportunities, like working through direct service providers and then through the county public health departments. Are those some strategies, or let me ask it in a different way? Are there strategies that the Disability and Health Program is taking on, or may be able to take on, to kind of bridge that gap, so that people with disabilities are feeling more welcomed because of interventions that fitness programs and other programs are doing in Iowa?
Yeah, well, we certainly hope so, and I could talk a little bit about the work that we're doing with disability service providers, and I should mention that a key partner that we work with on this goal is Easter Seals Iowa, and they've been doing really great work around inclusive health and wellness for a long time now. They really embodied what Maggie was saying about making the healthy choice the easy choice as a whole organization several years ago, and so we're working with them to kind of mentor and work with other disability service providers across the state on a more individualized basis to help them, change their organizations in ways that promote healthy living, healthy eating, physical activity. Examples that are, they were talking about how years ago they wanted to do more to influence the health and wellness of their clients, but they were realizing that if their staff weren't modeling the behaviors that they were hoping to influence on the people that they were serving, then it wasn't really working. So they started at an organizational level and offered more employee wellness opportunities, changed out the vending machines, from soda to water and other more healthy choices and things like that. And we're also promoting a program called, it's through the, Maggie might have to help me with this acronym because I always forget it at the last minute, but it's through NCPAD, which is the National Center for Health,
Physical Activity and Disability.
Physical Activity and Disability, that's NCPAD. And they have a 14-week program that is focused on, it's a, there's all sorts of programs, people have heard of that, promote health and wellness and, help people set goals and stick to those goals. And this is a program that was designed especially for people with physical disabilities, and we're working with disability service organizations across the state to implement this program in a group model. So it can be done by anybody. You don't have to be a expert in physical activity or nutrition. It's a lay leader model. So kind of what you were saying, some of the limitations with living well with a disability, you know, this really can be replicated by others. And we have guides on how to do that. And there's a complimentary online component that helps tailor exercises to somebody who might have a mobility limitation or something like that, so the person leading it doesn't have to take on that responsibility. But we have information about that on our website, which we'll have our producer put up on the screen. And yeah, so those are some of the things we're doing with disability service organizations. And I think Maggie can talk about some of the work we're doing with County Public Health.
Great.
Right. Well, and I would just mention, if people wanted to Google 14 Weeks to a Healthier You, that's the full name of the program. And it's a free online program that people can just go in, enter some information about themselves so that they get the customized program back. But as Caitlin said, we have the ability to work with disability service organizations to offer a group model, because when you're in a group, it just reinforces some of that accountability, and everyone likes, a lot of people like working out with a buddy, and it just holds you more accountable to your goals when you've shared them with other people.
And, you know, and not just disability service organizations, I guess, you know, anybody who would be interested in the state who would like to implement that program can reach out to me or Maggie.
Well, you know, what'd be really cool is, and I don't know if there's been research on this program, but, you know, kind of going back to the theme of, you know, people then being able to go into their own fitness center or wherever they want to go, you know, that sounds like that program really could give people the confidence to know that they can work out and, you know, maybe take a buddy, because I agree, it's not much fun to work by yourself, but to then go to the fitness center and say, okay, now I know what I need to do, and if they, you know, they could in a sense be
Empowered
to be empowered and be
Absolutely.
instructors to the instructors on how to adapt.
Absolutely. And to me, that's such a, like, common experience. You know, it doesn't matter if you have a disability or you don't have a disability. I mean, I know that you know, I'd never been to a gym until I was, you know, out of college, and I thought, you know, I didn't know how to use the machines, and you know, all of this, and you know, what it took was, you know, getting a buddy and going to a class, and, you know, just sort of demystifying the whole thing and feeling a little bit more comfortable to kind of set me on track.
Absolutely. And Maggie, I think I interrupted you. So
Oh.
what pearl of wisdom were you going to share there?
Oh, and I was going to, for the folks that are listening to the program, the website for your program where they can get more information is livingwelliowa.org.
Yes.
Okay. So just wanted to make sure that that gets plugged. But you had asked about the work that we're doing with the local public health, and, and very much similar to the work that we're doing with the disability service organizations. In Iowa, we have a health plan called Healthy Iowans, and based on county needs assessments and health improvement plans that various counties have put together, they might have contributed a goal to that Healthy Iowans plan. And so we are able to support the counties who have identified that they have a need with their citizens to increase their physical activity or improve their nutrition or to maintain more of a healthy weight, and develop more inclusive programming. So we're able to act as kind of a consultant to those programs to give them ideas. And a lot of areas are already implementing some things.
Good.
As far as they're looking at universal design in their communities to make environments more walkable. And so I would really encourage your viewers, particularly those that may have a disability, to get involved in their communities, because having that disability voice at the table is very important, especially early on in the planning process. So when I work with the local public health, I encourage them to partner with people with disabilities so that they get that perspective early on, and so they're meeting the needs of that part of the community.
So I hope I'm not putting you on the spot, but I know that in the past that this part of the project is kind of, you know, in terms of more direct interventions, that you've worked with a couple of counties or a few counties that have expressed specific interest in taking on some additional work through their health departments. But let's just say that somebody here in Johnson County wanted to really, is there do county public health departments have kind of like an ongoing planning process where they update their community needs assessment and health improvement plans?
They do, and unfortunately I'm probably not as knowledgeable on that area as I could be.
Oh, that's right.
But they do look at those annually and update them regularly through, like I said, the needs assessment for their county, as
Sure.
well as ongoing setting of goals.
And I was going to say as well, I know that many counties do have advisory boards. I think you could probably Google or look up your own county. I know that the Johnson County Public Health Department has a planning committee and has expressed, a desire to include more people with disabilities and be more inclusive in their planning in the future as well.
So regardless of where you are, and this because we're now on YouTube, we may hopefully we'll reach people from other states that may not necessarily have a formal agreement or working specifically through a disability and health project like we're fortunate enough to have in Iowa, but still going to your county health department and saying, gosh, I'd really like to learn more about what you do and figure out how I and perhaps other people with disabilities can get more involved. Sounds like a good strategy to
Totally.
get started.
Right. And I think if you look up Iowa health improvement plans, you probably will be able to land on what some of those goals are.
Yeah, definitely.
And you can take a look for your particular county, and if you see goals that they're working on, for example, community gardening is a very popular goal because of the need for improved nutrition among all citizens. And so that could be a great way to offer up some of your lived life experiences to make those community gardens more accessible.
Absolutely.
Great. Sounds like, I was going to say who wouldn't want to do that, but I don't know if people don't like here. But I mean, it is such an exciting.
Well, and that's just one example.
Right.
Yeah, as a person with a disability, I kind of came into gardening the back way, and it's whatever the activity is, just being active and trying to get in rather than creating your own model. I mean, that's what I really like about the model that we have with our state disability and health grant, is that we're able to help people tap into some already existing resources.
Totally. And that really, is kind of the CDC wants us to be focusing on what they, the acronym PPSE, so programmatic, policy, systems, and environmental changes, so that we are, the work that we're doing is influencing the system, rather than doing one intervention that, exists for the life of the grant and then goes away. Really taking a high level look at how we can impact things long term.
That's great. Well, and there's a third component, as I guess Caitlin mentioned, and I'm going to take off my host hat and talk a little bit about the Health Provider Training Initiative within the Disability and Health Program, because it's one of the initiatives that I work on, and either Maggie and Caitlin just jump in and please add on. But it's a really exciting initiative that we've had going in one form or another for over 10 years now. The overall goal is to help students and practicing professionals, as Caitlin said, be more comfortable working with individuals with disabilities. And we do this in several different ways. Probably the most prominent way that we do it right now is that we train students in the healthcare professions on how to serve patients with disabilities. And we have a couple of different types of trainings that we do. One is what we call our large group, more of a lecture format, where we're actually presenting information about how to support people with a variety of disabilities, whether they be physical disabilities, hearing disabilities, visual. We talked some about working with people with invisible disabilities, speech impairments, and we do that through a combination of presentation and a series of videos that we've developed. in which we sometimes will demonstrate an incorrect way of providing support to a patient with a disability and then talk about the correct way of doing that. Our audiences have focused primarily at this point on the University of Iowa. For the large group trainings, we're working with the College of Nursing, the dental school, the radiation sciences training program, physician assistant training program, and as well as the College of Nursing. And then we are focusing the small group trainings in which students actually have the opportunity to come in and visit with patients and their families for short periods of time. The training itself lasts about 2 hours, so I say short period. They actually do get about 25 minutes per patient or family to learn about what that person's experience is with the healthcare system. So that gives them some real direct time to interact and talk with the patients and their families. We have expanded recently to St. Ambrose University with the large group training, and then we're also working, we did a training a couple of weeks ago with Blank Children's Hospital in Des Moines, their residency program, and later this week I'll be going back to Des Moines to do a program with Des Moines University. So it's really exciting. We're just finishing up the final tweaks to some of our videos, some final edits, and then those will all be on a website, which will certainly share that information through the Living Well Iowa website that Maggie and Caitlin have already talked about. So
Yeah.
So,
And I just want to mention one more thing about the livingwelliowa.org is that we have tons of resources up there, including resources for healthcare providers on talking to patients about health and wellness, accessible communication, resources for disability service providers, local public health agencies, and just really anybody, I mean the general public, on health disparities, on emerging practices for healthy living for people with disabilities, and even things like chair yoga or adaptive cooking classes on YouTube for people with intellectual disabilities, things like that. So we encourage you to check it out.
Yep. And I want to thank, I can't believe how quickly this has gone. I want to thank both of you for coming and joining us today. Maggie, did you have any
Absolutely.
final comments? Or
No, I think we really covered a lot.
So, especially want to thank you for making the trip in from Des Moines. We really, really appreciate the opportunity to partner with the Department of Public Health. It's been
Definitely.
a partnership that's yielded many, many positive results through the Disability Health Program and others, as we talked about last week. And Caitlin, really appreciate you taking the time to come and talk with us about the Disability and Health Program and your role in it.
Yeah.
And want to thank all of you out there for viewing. Certainly want to thank our sponsors, and we'll see you next time. And as my good friend and co-host Keith would say, have a good week out there.